Melissa Fuller with Shape of the City. I am here with Dr. Bob Rauner with Partnership for Healthy Lincoln. Partnership for Healthy Lincoln has worked with Lincoln Public Schools over the years, and they have worked to evaluate the relationship of fitness and physical activity as it relates to academic performance. Partnership for Healthy Lincoln also has worked with a project called Place Matters, a mapping project that looks at where you live as a relationship to your health. Can you talk to us a little bit about that project? What are the outcomes? What are the impacts that you are seeing, and how are the different ways that you can look at these maps?
Yeah. Well, mapping is kind of a new technique to find out. We've got lots and lots of community data, but people really haven't in the past looked so much about where it's getting better or worse, looking at just overlaying on a map of the community. And so a lot of sources of data now are becoming available where you can do this, whether it's crime rates, access to prenatal care, but even school data like physical fitness, for example. And so the Community Health Mapping Project took data from all these different sources, created them on overlays of maps, mostly using census tracts to say, okay, where are things better or worse in town? And then hopefully the next, what will we do about it? Probably the most common theme is that most of these factors tie back to socioeconomics. So the relative wealth of the neighborhood has effects on everything from access to prenatal care, aerobic fitness of the kids, longevity, even academic achievement in schools. And so, great, now we know this information, now what are we going to do about it? I think that's the next step.
What are some of the things that you as Partnership for Healthy Lincoln will be looking at specifically?
We started looking more at weight and aerobic fitness because it had a lot. Those are our two main things we could measure with the health of children. And so it's kind of some have grown over that in the next 10 years. In the last few years, we've been working with the Community Health Endowment to add that to the mapping project. A lot of these health things start out at a very young age, and so the younger they start, the better. So if you're going to talk about longevity when you're 70 and 80, some of those habits start when you're 5 and 10 and 20, and so we really, if we want to make a long-term impact on the community, we need to start young. And even some of the things like I really am excited that they added access to prenatal care, because even those things are dramatically different from one census tract to the next.
So what can you also learn from some of the anomalies?
Okay. Well, sometimes things buck the trend, and then that's where I think where the most interesting ideas come from. There's a couple techniques that are used worldwide. One of the best examples is something called the Camden Coalition. It was a family doctor named Jeff Brenner in Camden, New Jersey. Started mapping things like admissions to hospitals and emergency room rates and finding out that they were coming from small pockets in the neighborhood. And so one thing they did is they started sending out community health workers to those pockets of the neighborhoods, and lo and behold, they made a huge difference in how many people were landing in the hospital emergency room by dealing with things in the neighborhood sooner in a more targeted fashion. And I think that's where you're going to start seeing a lot of things opening up. Our data right now is only census tract level, which is too big. We need to cone it down and figure out where can we best put the resources that are needed. Another example is that, for example, academic achievement and fitness are very correlated with the socioeconomics of a school. But there are some schools that buck that trend, actually. And so for aerobic fitness, for example, Park Middle School, despite having a very low-income population, actually its fitness rate's not that far off of some of the wealthiest places in the neighborhood and in the other neighborhoods. So what could you learn from that? What's going right at Park Middle School that could be reproduced at other middle schools? Another example in academic achievement, you see very tight correlations again, but one school really bucks the trend, and that's Belmont Elementary School. So what's going right at Belmont Elementary School? And are there any things that are happening there that we could transfer to all the other lower income elementary schools and get similar improvements? And what they find is that everybody wants the one solution, like if I just put an EduCare everywhere, will that fix everything? Well, EduCare is probably part of why Belmont's doing better, but it's probably not all of why Belmont's doing better. It may have something to do with the community learning center, the leadership of the principal, the mentality of the teachers, the cohesiveness of the neighborhood or the park. I mean, there's a lot of things that go into that. And so I think one of the more interesting things now will be look at frankly, the people who just don't fit what you'd predict. Why are there surprises in a good way, and what's reproducible that we could do someplace else?
So what's next?
Okay. Well, I think next is trying to figure that out. So, for example, when I was looking at the fitness data, talking about it with Matt Avey, who's the head of Health and P curriculum at Lincoln Public Schools, pointing out park, he's like, yeah, I think I know what's going on. So he is talking with the park principal and the P teachers there saying, okay, what are you doing different that maybe, Kohler or Loeffler or some other places could do? From the academic achievement side, I know Lincoln Public Schools know that Belmont overperforms for a while. But what other things are there? What's going on? What could they do that could be transferred someplace else? And if it's broader than just the school, it may be a neighborhood level solution or a community learning center level solution. So it may be more than just what the school can take on by themselves. And I think sometimes in the past, for academic achievement specifically, people want to blame it all on the school or blame it all in the neighborhood. And honestly, it's a combination of those, and it's going to be a broader solution. So we have to get people from off of that one solution mentality, quick fix mentality. But we know the data shows that it can be fixed at least. So don't have a defeatist attitude. There is ways to make this better.
So I know the maps are accessible on the Community Health Endowment's website. I think it's lincoln.ne.gov. Are there any other last messages you'd want to leave with our viewers?
Okay, well, I think just learning more about it. They've got, the Place Matters maps. They've got a brochure. It's on the website. There's presentations. I know Lori Seibel has been giving them to a lot of community groups. I think it's a great conversation starter tool about what can be made better. Learning more about the neighborhood and the makeups of Lincoln, I think it's a very helpful thing to start seeing this. It's a better way to look at data. Just seeing, columns of numbers isn't as helpful, but when you turn into visuals where people can see the differences, I think it's much more helpful. So I think first is having people get more educated on it, and then second, okay, now what are we going to do about it? How do we marshal the resources, the funding, the things like that to fix these problems?
Perfect. Thank you.
What if you could add 5 years to your child's life and make your whole family healthier with simple changes? Partnership for a Healthy Lincoln wants you and your family to live longer, healthier lives. It's easier than you think. Walk the dog every day, play more, and text a little less. Swap out a sugary soda or energy drink for water once a day. Keep fruits and veggies handy for snacking. These simple changes can add 5 years to your child's life and make your whole family healthier. Learn more at healthylincoln.org.
The Lincoln-Lancaster County Health Department is in the process of preparing for the upcoming flu season, which began October 1st and runs through the end of April. The best means of prevention in terms of influenza and preparing for the flu season is getting an annual immunization for influenza. It not only protects you, but it also protects your loved ones as well, and particularly those who are at risk for complications. By getting your flu vaccine, you're protecting those individuals as well as including infants under 6 months of age who are unable to get vaccinated. Flu vaccine is readily available in the community or through your local healthcare provider or through pharmacies, urgent cares, grocery stores, supermarkets. Flu immunizations are also available through the health department for adults who are uninsured or underinsured by contacting the health department at 402-441-8065 to set up an appointment. This is the time to prepare, and preparing means going out and getting your annual influenza vaccine to cover yourselves and protect not only you, but your loved ones. So do it today.
It's everybody's responsibility to be fire safe. Improper cigarette disposal is one of the leading causes of fires in homes.
As someone who's been a victim of a cigarette-related fire, I ask you to put out your cigarette safely.
One flick can ruin many lives.
Please, put out your cigarette safely.
Learn how to stop the fire before it starts. Visit tobaccofreelancastercounty.org for information about safe cigarette disposal.
Hi, this is Michelle Welch, registered dietitian and wellness facilitator for Lincoln Public Schools, talking about dressing for the weather. We all think of that Christmas story moment when the kid can't put his arms down, and we've all felt like that as kids because our parents used to buy us those giant puffy coats that we really couldn't move around in. Technology has changed, and we really have opportunities as adults and as kids to dress warmly without feeling like we can't put our arms down. Part of the difference is really what we're doing with layering. And so to kind of give you some examples, for me, if I'm wearing skirts, I'm always wearing a pair of tights, and maybe if it's really cold, a pair of fleece-lined tights over the top. Makes it so that I can wear skirts in the winter and still be able to enjoy not freezing to death. Further, for kids, you can even use their jammy pants underneath their pants to be able to give them an extra layer of insulation if you don't have things like long underwear or other layers to be able to work with. They'll feel like they get to wear their pajamas to school and no one even knows. Further, when we look at our upper body or our middle body, I'm usually wearing an underlayer like this with maybe like a vest over the top of it. For kids, they really do great when they have these active shirts like these that wick the moisture away from them. You know, kids are outside and playing and running in ways that we as adults don't typically get to do during our workday. So really them being able to have this take that moisture away from them really keeps them tremendously warmer and is a huge important part of getting them dressed for the winter. And you can buy them for just a few bucks at a discount department store. Further, again, just like us with a vest, something like a fleece vest or a thin sweatshirt type item can really make a nice difference for them. And then as our outer layer, whether if it's going to be cold for winter, I have like these really super thin, inexpensive kind of mini puffy coats, Or for the kids, they have these nice jackets where they just are preventing the wind coming through and the moisture. So something that doesn't take a lot of bulk, but that can really still be that protective layer outside these inner layers. For us as adults, as we're getting dressed, if I'm not having to worry about the moisture, I'll just throw on a wool type coat. And then most importantly, I have a scarf or something along that line. And this scarf actually can flip into a hat, or if you have a hat that you like, throw a cute hat on. If you're telling the kids they have to wear a hat, you need to wear a hat too. Make sure that you let your kids pick out their hat so that they're more likely to wear it. You know, hats are an important piece of their puzzle, and kids really struggle against those. So by us demonstrating wearing a hat and them having a hat that they like makes a nice difference. You know, for the fall, these gloves kind of work okay, but when they get to snowball weather, we really need to have a thicker glove that has a little bit more weatherproofing to it. It doesn't have to be super thick, but something that they really feel like they're going to be able to wear, and make sure you put their names on them so they don't lose them at school as easily. Finally, we can't forget about the feet. Wearing a couple layers of socks can make a nice difference and keeps you from having to have quite as much puffy insulation. But a boot like this can work for us as women and for kids. And for guys, they can do either a hiking boot or a snow boot, and it can really help protect them from the wind and the water and the elements to help stay outside longer. So finally, we want to really have kids be active, but we want to always keep everyone safe. So pay attention to winter weather advisories, or when it's blowing and just conditions aren't right to be outside. But when it's just a hair warmer, get out there with your family, layer the kids up, layer yourself up, and have fun with your family. If you're not going to be outside with them, make sure and set a timer so that you can really pay attention to how long the kids have been out, because they don't have a good indication of when they really should be coming in. They need us to help guide them. Get out, have a fun time making a snowman with your family, and enjoy a nice, active winter outdoors.
My name is Damon Hershey. I'm one of many people in Lincoln that rides a bike year-round. It is important for winter riding to be prepared, especially being visible. You want to have a good quality light. You want to be visible to all road users. You want to be sharing the road. You also want to remember the 3-foot passing law. That's a safety for both the cyclists as well as the motorists. And of course, if you'd like to find out more, you can visit lincoln.ne.gov.
I'm Melissa Fuller with Shape of the City, and we are going to talk a little bit about hospice care as well as home care. And we are at the main office for Tabitha Health Care Services here in Lincoln, Nebraska. And I've got some amazing people to talk to. All right, so let's talk a little bit about, let's start with hospice. Can you tell us a little bit about how would you define hospice for most people? What does that entail?
Hospice care is a service that's provided to all individuals with a terminal diagnosis so that they've received from their doctor. We follow people wherever they're living, whether that's their home, a private home, a skilled nursing facility, an assisted living. So we go wherever they are, and we provide those support services, which is a Medicare covered benefit. So there's no cost to the family. And we provide an interdisciplinary team approach. So they get a whole team of people that are the experts in the end-of-life journey to help support them.
Give us an example of some of those support services, just a general picture.
Each person, when they come onto hospice, is assigned really 4 team members. So they have a nurse, they have a social worker, a chaplain, and a hospice aide. So all 4 of those team members are coming in to provide, whether it's medical support, psychosocial support, spiritual or financial support to help them through that time.
Now, if there's a viewer out there that thinks this might be something they have to be thinking about either for themselves or maybe a loved one, what are those questions they should be asking to get them prepared?
I think, first of all, they're going to probably be having the conversation with their doctor. The physician's the one that is giving them that terminal diagnosis. Then they really need to think about how they want this last part of living to look. It helps them stay in control of this journey. And I think the hardest thing is that emotional component. It's realizing that by choosing hospice, you're giving up that curative or progressive type treatment. And so being able to wrap your head emotionally around that and focusing on comfort and quality rather than curative.
All right, and that same sort of idea, what questions should they be asking potential hospice caregivers?
I think when they're looking at hospice agencies, some things to keep in mind are we're all governed by Medicare. So there's Medicare regulations that we all have to follow in hospice. looking at whether, what's important to you. There's going to be for-profit agencies, there's going to be nonprofit, there's going to be faith-based. But I think most important is understanding the services that hospice agency is able to offer and how the team approach works, what services they're going to get from each team member, as well as understanding the on-call, because most times we have a crisis, it's after hours. So understanding how all of those services work and the staffing.
All right, so Tabitha also deals with home health care. Hi, guys.
Hi.
Can you talk a little bit about what that entails? What sort of services are involved with home health care?
Sure. Home health care is a wide range of services provided in the home to treat an illness or an injury. At Tabitha, our home team is all about teamwork with a focus on quality to provide the best care possible. So our top-notch team includes nursing, PT, OT,
Yep.
speech, bath aides, a dietitian, and a social worker. And so,
Yeah, I mean, we all work together to you really provide a great outcome for people. We're always working with the doctor. We need to get a doctor's order in order to come out and see people. When we do that, the doctor's always involved. So, we always make a plan for what someone is looking for in terms of recovery and getting better.
So a viewer who may be interested in home health care, who are the people this is for? Who are the people that should be approaching you guys if there's someone watching?
sure. Well, anyone who has a skilled need or a loved one who knows someone that has a skilled need should talk to their physician, and then the physician will decide what home care services are best for them. And we personally, we believe that the partnership between a client, their supportive loved ones, the home care provider, and the physician are extremely important.
There's a number of different people you mentioned. The first one being like someone that maybe just had an injury or something like that and just needs some acute care, some short-term help. There's also people that are maybe have some chronic illnesses that could benefit from our services as well.
Why is home health care so important? How do you guys see this as an important service?
Home care is customized for the client, and we create goals that will be personal or personalized for them, and because we want our clients to reach their goals so they can get back to living their best lives possible.
And it's great for people being able to do that in their home. A lot of times, going to places that are unfamiliar, like hospitals and things like that, are a little daunting for people, and they feel most comfortable in their home. So it's great we're able to provide those services in the home and able to, work where they feel the most comfortable.
So for caregivers, loved ones out there, it can be a really rough period, and there's a lot of support I imagine they need. What recommendations, what's out there, what sort of support do you guys have, or what would you recommend people doing?
I think the great thing, when people are on hospice is again, having that whole team approach. That team is going to know what resources are available in the community, either through Tabitha Hospice or through another agency. And we're so lucky that we can connect those caregivers. So looking at whether that's bereavement support, Tabitha has bereavement support for 18 months. We are in touch with all the adult day communities in town. If people are still working and they need care from 8 to 5 for their loved one, but still want to keep them at home in the evenings. Different caregiving agencies, even just some respite from that day-to-day where they have the hospice team coming in and scheduling visits around so they can go to the grocery store, so they can do those kinds of things that have to be done. Medicare also offers with hospice a 6-day, 5-night respite. So you bring your loved one, let's say you have a wedding coming up or you have a graduation that you're wanting to go to, and that's hard if the client can't travel. So bringing them into a living community where they can stay for 6 days and 5 nights can be super helpful. So I think just knowing that, having that team that's going to help support whatever stresses and crises that come up, that we're going to be there to help walk you through that.
Perfect. In terms of this, I imagine this applies to home health care as well. There may be people who are caring for a loved one who may be not in a hospice situation, but may need that extra support.
Yes, in home care, we focus on creating goals that are individualized. And so if it's home safety versus wanting to plan for the future. We have our therapists that can set up a home safety plan, and we also have a social worker for future planning. And we want to create a great environment for our clients and let them be where they want to be, where they want to call home, and want them to have as much independence as possible.
Along with the independence comes the home safety, like she mentioned. I think I see a lot of people that really don't know what equipment and things are available for patients to help to keep them safe at home. So we as therapists will go in and evaluate the home or their living space and be able to find the right tools for them to be safe so that they can be independent and really ease some of that burden on the caregivers and the family to know that they're safe with some of that equipment in the home.
And it sounds like Tabitha is a place, even if you just had those questions, you just don't know even where to start, you guys are a great place to start with those questions, correct?
Absolutely, because Tabitha has the whole continuum of support from rehab to skilled facilities to assisted living to home health to hospice. One number it's one person in continuum navigation that can answer all their questions and direct them to the service line that best suits their needs.
Us in home care at Tabitha, we care about you. We value our clients, and it's always our goal to identify, clarify, and anticipate needs in the home to exceed expectations during our visits. So look to Tabitha for support, because us in home care, we love what we do, and we do what we love.
That's amazing, and I know healthcare has become more and more important, everyone knows, so everything you guys are doing is amazing, and thank you so much.
Thank you.
Thank you.
Shape of the City is dedicated to keeping Lincoln informed of health and wellness programs and events. Visit our calendar at lincoln.ne.gov, keyword Wellness Calendar. If you'd like to see your program or event covered, email us at LNKTV Health at lincoln.ne.gov.